What comes to mind when you hear the word artificial intelligence? Well, for our next guest, it means hope. Dr. April Kadami is a Canadian Cancer Society-funded researcher and Canada Research Chair who is exploring how AI technology can help diagnose the disease. And she joins us this morning to talk about her research. Doctor, it's good to see you. Good morning.
Good morning. Thank you for having me here today.
And this is really some exciting times. But before we get to what's on the horizon, maybe we can talk first about cancer and how it's been primarily diagnosed through the years. Maybe you can explain how it's currently being done.
Sure. So when a patient has suspicion of cancer, they usually remove a small piece of the tumor, and this piece of tumor is sent to a pathologist. And the pathologist looks under a microscope to look at cells and tissue under magnification. And they do this in order to assign scores, grades, and these scores and grades are used to decide therapy. So pathology is the definitive diagnosis, and it's imperative and a critical piece of the patient pathway to decide therapy.
But now you are looking into and researching a new, faster and more reliable way, right, to diagnose patients using AI?
Yes, exactly. So in my lab, the Image Analysis and Medicine Lab, we're leveraging artificial intelligence algorithms and computational power to help pathologists with the tasks that they do currently. So we're here to augment their workflows. We're not here to replace them, but we're here to help them do the job that they already do. And so, for example, our tools help to count cells, characterize cells, and it can do it more concisely, more accurately, and it can lead to better treatment decisions and better patient outcomes.
Which obviously is what we're all looking for here. And all cancer research needs, it goes without saying, funding to get off the ground. So how important is funding to the work that you are currently doing?
Yes, exactly. So as a researcher, if you don't have funds, you can't hire grad students, you can't purchase equipment to do your research. And so the funding from Canadian Cancer Society donors has been imperative to help me get my research to the point that it is. And we're starting to analyze larger data sets, and we're actually getting close to the point of translation of these tools, where we've actually validated a few of our tools on large data sets with many pathologists, and we show that it makes them more accurate and consistent. And what that means is that irrespective of the pathologist that looks at your slide, you will be assigned the correct therapy decision. And so without funding from organizations such as the Canadian Cancer Society, this work would not be possible.
Now we have the Canadian Cancer Society's holiday campaign, and it is all about how every moment is a gift. What is the campaign, what does the message behind it mean to you and your research team?
Well, it means that we can use our research to help find disease earlier, help it find it more accurately, and give patients more time with their families, more moments with their families. And without this funding, we couldn't do that. It has been an imperative part of our program, and actually we're starting to expand and apply it more widely on bigger data sets, and we couldn't have done that without the Canadian Cancer Society.
Well, we want to remind everybody that you can support cancer research like this by donating today, Giving Tuesday, to the Canadian Cancer Society to help those affected by cancer enjoy more precious moments with their loved ones. All you have to do is scan the QR code. You see it right there on your screen. As we mentioned, this funding obviously is imperative. It is tremendously helpful when it comes to the great work that you're doing. As I mentioned off the top, this is really some exciting times when it comes to cancer research. Just how personally excited are you, Doctor, about where we are today and where we're going with all this?
I'm actually super excited. So I've been working in this field for a long time, more than a decade. And when I first started working in this space, I remember the doctors telling me that, oh, software that can read medical images, oh, I would never use that. And I remember that's when I had started my PhD, and I thought, oh boy, what kind of career decision did I make? But I really believed in the technology, and so I stuck with it. And now we have doctors on board that are helping us develop this, that are actually giving us data and giving us critical insights into how our tools are working. And so that was a piece that was missing for several years, was the end user, which is the pathologist, the radiologist. They need to be involved with the research. So now they're excited, they want to do it. And so now we're getting close to the point where we are getting close to being able to apply this to real world data sets and in clinical practice. So we're getting close. I mean, as a researcher and engineer, I say my job is never done. Every day we find new problems, and that's fine. Otherwise, I would be out of a job. But we're getting close to real clinical translation of the tools that can impact patient care, and that's actually what gives me hope and drives me every day.
And if it gives you hope, it's giving us hope as well, because along with those everyday problems, you're also finding everyday solutions. Dr. Kadami, thank you for coming in.
Thank you so much for having me.
This portion of the morning show is brought to you by the Canadian Cancer Society. Donate at cancer.ca/holiday.